Kidney infection. So we're going to be talking about why kidney infection reoccurs, how to treat kidney infection, how to prevent it from reoccurring. Please, anybody you know that is suffering from kidney infection, have them watch this video and give me your absolute time. Don't fast forward because it's going to be a very long video. Secondly, if you're not on our WhatsApp channel, our Instagram, on our Facebook, just be there, search for Kidney Nurse Merits on all social media platforms. You will see us, okay? WhatsApp especially, join our WhatsApp channel because that's how we disperse some information. All right, so kidney infection is not just a normal infection. It's not just a UTI, urinary tract infection. It's an infection that became a UTI infection that has passed through your urinary tract from your bladder to your urethra and then finds its way to your kidneys. This is a serious issue. And when kidney infection is not addressed, in fact, reoccurring kidney infection every time you're having kidney infection can cause scarring of your kidneys. It can cause your GFR, your kidney function, to be reduced, and then it can actually cause chronic kidney failure, destroy your kidneys. So this is why it is important. You don't just go on and start taking herbs. Somebody will tell you pour this into cup and get dandelion and that's it. No, you can't use it to treat kidney infection. We are talking about infection here. So please, once you notice you have kidney infection, take it seriously. And of course, I'm going to tell you how to treat it. Now, what are the symptoms of kidney infections? Number one, smelly urine. Number two, your urine is burning you. When you're urinating, it's burning, it's painful, itchy. You're having fever sometimes. In the evening, it comes and go. And then, very important, most prominent symptoms is your side. Your kidney region is paining you, which is your side, okay? Seriously paining you, okay? And these are the typical signs of kidney infection. Then foamy urine that smells. When you urinate, it smells. Frequent urination, you urinate and then you go back, urinate and you go back, okay? Now, having talked about that, why does kidney infection reoccur? Okay, number one reason is that your immune system is low. When your immune system is low, infections occur, especially urinary tract infection. So you have to, when I'm treating people, the immune system has to be high, okay? You build your immune system. Number two, you take lots of sugar. So sugar breeds room for infection. So sweet drinks, juices, cola, all of those things, you have to eliminate it from your diet. The next thing that causes this is that you are not drinking enough water, okay? If you're not drinking enough water, your kidneys will not be helped to flush these things out. So you need to hydrate more. Drink from 3 liters of water, 2.5 liters of water to 4 liters of water daily, and then nothing else, okay? Now, another thing is that you're resistant to antibiotics. You've become resistant to antibiotics. So we've seen this a lot. This is one of the reasons why this happens. So the cause of this is, number one, they have to do tests for you to find out the antibiotics that you're not resistant to. I'll come to that on the treatment. So let's just finish with our why it comes back. So resistant to antibiotics. The next one is that you're having a blockage in your urinary system. So anything that makes urine not to flow freely out from the kidneys will make you have recurrent urinary tract infection, leading to recurrent kidney infection, which is pyelonephritis. So when you have bladder infections, this will find its way up when not treated. So anything like kidney stone could come off and block a part of urinary tract, and then urine will not be emptied. So whenever urine is filled with microorganisms, right, bacteria, so whenever urine is left in the urinary tract, or it doesn't come out in the bladder, or it doesn't empty fully, you urine, that's why you urinate, you still go back because urine is still remaining. So this will make that urine remaining there. Urine is meant to be out. The little remaining there will always go up. Okay, reflux of urine always goes up to the kidneys and infect it more. So kidney infections could cause this. Urethral stricture could cause this. Your urethra is tiny, it's not open, so urine can't pass through freely. Most of these things are congenital, so they require a surgery to open it up. Okay, so I think that is basically, I've talked about your immunity, and then immunity could be also affected by some certain illnesses like diabetes, with low immunity. Then another thing that can cause this is very important. Your women that uses scented soaps, perfumes on their private parts. Okay, this will make you have recurrent infections. Women or men, poor hygiene, very important, especially for women, even men too. So if your sexual life is the other way around, so you have to stop it. You have to put your penis in where it's supposed to go to, okay, so that it doesn't pick bacteria. So when you're engaging in sexual activity with your partner, make sure that everywhere is clean so that you don't pick bacteria. Your boxers is clean, everything is clean. Now, having known about why these things reoccur, and again, finally, abscesses in your kidneys. Abscesses, some people have pockets, abscess in their kidneys, or their urinary system. So these things, abscess is like boil on your skin. So this boil is infected, and when you're treating, let's say you're treating your skin, this skin now, infection is gone, but there is a boil. That boil contains water that is infected. So when it bursts open, it releases infection everywhere. So this could be seen in your scan or some graphical images with your nephrology orders, especially when they find out that you're already always having recurring kidney infection. All right, so the next thing is, how do you now treat kidney infection? Number one, improve your immunity. When you come to what meal plan, we tell you what to eat, what to avoid. Sugar, reduce your sugar intake. Hydrate, drink a lot of water to help flush these things out. Number three is from the why it reoccurs again is that most of the times you don't finish your treatment. Okay, so most people start their antibiotics, they finish it, and then they think it's gone. Meanwhile, it's still remaining. Why some people start and they don't take it judiciously and they don't finish it. So this could also be the cause. So next thing you have to do is that when you are diagnosed, the first thing you do when you have kidney infection is, first of all, go see a nephrologist. Most of the times your doctors will just want to treat you, normal doctor, but whenever you see that it is reoccurring, you have to see a nephrologist. Okay, who orders tests, find out what is going on. Has it affected your kidneys? There are some deeper tests that they will do, not just because of the kidney infection, but to find out, is this kidney affected by this recurrent infection, so that we know what to do. Okay, so get to a nephrologist. If you can't get to a nephrologist, it's fine, you can use your doctor. Please use a doctor with experience. Just use a good doctor. So your doctor, don't go to a pharmacy, don't go to a chemist. Your doctor orders some tests for you, and which basically includes urine MCS, your culture, to take it on the other level, urinalysis, kidney function, and some other tests. And then with that test, especially for treatment of kidney infection, is the urine MCS now. They use the test to find out the antibiotics, the bacteria that is you're resistant to, and the one that can work, and that is resistant to, an antibiotic that is resistant to the bacteria, and antibiotics that can actually work. With that, they prescribe antibiotics for you, which you take. But the problem is not just taking. Number one, take it judiciously, finish it. After finishing it, don't just go because you're not noticing the symptoms again. go back to that doctor. Even when you don't have an appointment, redo those tests to find out if this infection is cleared. After finishing your antibiotics, redo the test, give like a 1 week gap so that the antibiotics does not stay in your urine. Then redo the test, let your doctor see it. If it's still there, you continue treatment on everything until everything is gone. Because your doctor may say take these antibiotics for 2 weeks, for 3 weeks, or 1 week, which is a full course, not knowing that okay, he was not able to clear everything. Little is remaining, and that little, if you don't clear it immediately, it goes back to cause, multiply. So go back, your doctor will run this test to make sure that this thing is gone, and that is it. After that, please build your immune system. Drink a lot of water. Cranberry, you can do fresh cranberry juice, and then try to improve your hygiene. Okay, sugary drinks, really avoid it. Eat things that are high in probiotics to build your immune system and protect your urinary tract, like unsweetened Greek yogurts, some food high in probiotics like iru, use it to make your food, ogiri, oba, cabbage, some fermented foods. Okay, this will help in that place. Then after treatment, this is where the whole thing comes in. After treatment of antibiotics, for instance, if you come for me for treatment of kidney infection, you have to take antibiotics. So when we find out, after you see the doctor prescribes and everything, after your treatment, we prepare a herbs for you. So these herbs, you're going to take it for a month plus, okay, which will help you flush out anything that is remaining. It's like you having something off your system in case. Antibiotics is stronger. Herbs are also strong too, but it's not something to be taken for a very long period of time. And antibiotics can't be taken for a month. No, so your antibiotics is a short course. So herbs is for a long course. So you give you herbs that you can take for like maybe 6 weeks. You take it every day so that it will be on your system to help any little ones that is remaining, is flushing them out. So this is one of the patterns I've used in helping people that have recurring kidney infection, okay, to help them. So this will really help you have these things off of your system. But I have to find out why is this thing reoccurring, and then tackle the root cause, then give you something that will be on your system, that will not harm your kidneys. Okay, so I think that is one thing. And then very important, when you're treating yourself, make sure you treat your partner, and don't have sexual intercourse with your partner, because you can reinfect yourself with other infections. Make sure your partner is being treated, okay, and have your partner have the same thing you're taking at the time. So the other things you can do, if you can't order the herbs, you can, I don't know where you can get them, but parsley, ginger, garlic, these are the few things you can get in your part after treatment. Continue to take these things. And cranberry, there's some other, we use basically Chinese herbs in preparing your UTI guard. Then if you're in Abuja, it's very important that you keep ordering the UTI smoothies and detoxes at least for a month. It will also help you build your immune system and remove this thing off of your urinary tract. That is after treatment. So after treatment, after care is important. You keep caring it for your system for like 2 months before you stop, okay? And then it's a lifestyle. Don't just go back to your former lifestyle, reinfect yourself. And so that is all about it. So if you want to have a conversation with me, have other herbs or anything, simply charge the number on the screen and my secretary will get you to me. So like this video, share. Remember that when it comes to UTI treatment, I work with doctors, okay? So it's not just Tosmerit. You may be asked to see a nephrologist, and we have them. You will be asked to see a doctor. That's if your money is not to for a nephrology consultation. So we may ask to see a doctor to help. All right, see you on another video. Have a nice day.